Hi, welcome to Choosing Recovery. My name is Tricia Gibson. I'm a licensed professional counselor and licensed independent chemical dependency counselor. We host this show monthly to discuss the hot topic of substance abuse around our area. Today I have two very special guests. We have Meigs County Sheriff Keith Wood and Major Scott Trussell of the Meigs County Sheriff's Office. Thank you both for joining us today. I appreciate you taking the time out to come talk to us. Really what we wanted to talk about, there's a lot to talk about for us. We have some school shootings going on. We definitely always have the issue of substance use. What are you guys seeing in Meigs County as far as a substance abuse problem? How is it impacting what you're doing?
Well, I think that as any community across the state or this country, we're dealing with constant problems with drug addiction, drug dealing and trafficking that's going on in our communities, and we're trying to always stay in front of that to primarily kind of teach people that you can't do that in your community. So it's quite a process that we've been through. The heroin has been a major problem in our community. We've been trying to deal with some methamphetamine problems, but the opioid problem, it by far just surpasses anything that we are facing in our agency.
Okay. As far as trends in Meigs County, you mentioned the heroin. Is there any one drug that seems to be the problem? And if so, what is your office doing to try to combat that?
Well, one of the biggest things of combating this problem is focusing at our schools, of trying to educate the kids, trying to get ahead of it with them at early ages and teach parents too of this problem of what we have to deal with. I mean, any drug that is of choice by the people, and whether they get addicted on it through a stepping process of wherever they have been in their lives, but we intervene usually at the worst time. I mean, where they're in trouble or they're trying to get out of the situation they're in. So that's kind of where we're at with it.
Okay. You mentioned schools, and I would like to highlight that you're one of the first sheriffs in Meigs to institute a school resource officer in all the schools. And I think that really provides a level of safety, especially since we have, in the media, we've had all that news about school shootings.
Absolutely.
That's kind of a whole different topic, and that really relates to mental health, but I think that also comes into play with substance use. They're very much related. So what are we doing in Meigs County as far as things in the schools and safety procedures?
Well, we have, like you said, we have a resource officer in each of our school districts. We have one of those officers works in Rio Grande College and works in one of the special needs class schools that we work with. So we have reached out to all the schools in our community to try to offer support for them, offer an officer being there for the safety factor, but also being there to teach and educate what they need to know. I mean, the problem with this drug problem is, I think a lot of times they're not getting good guidance maybe at home, or they're getting connected up with friends that, and we're trying to steer away from that to help them a little bit and help the parents too, to realize that they've got to be a part of this. It's a community effort to fight the drug problem. So then you do get into situations where you have a lot of social media things that go on within the schools. It's a different culture we're in today, because the technology we don't sit and talk to each other about things, or we do it through the telephone.
Sure.
And so it's changed a lot of things of how we do things with enforcement, because when you have social media threats or things that's associated with even we have people contact us where there's drug deals going on through this type of contact with communication. So it's challenging for us. We're a small agency. We have about 15 officers that work out of our office, and that's a small agency.
Sure.
So dealing with a county population of about 24,000 people, but we're staying in front with the schools. We had a meeting this morning with all the superintendents in the county, the district superintendents. So we're looking at different ideas of how you blend in law enforcement to communicate with the kids. I think that's a very important part that's got to happen with this. I mean, with what's going on across the nation with the shooting stuff is just
Yeah.
sad situation.
That was
right
one
now.
thing I was going to bring up. I like that you're teaching and educating children and teachers and their parents about how, you know, law enforcement works, and you're there to help and protect and serve.
And they've done a great
you know.
job too. That they've in the time that we've been here, I've been here for 5 years now plus. We do the ALICE training. We work with the teachers. We work with the staff on some of this stuff. They've actually began a new project that their own staffing is involved in teaching themselves, teaching to them of what needs to be done. So it makes it a little more acceptable sometimes to the staff, because, you know, we saw some resistance early on back with the staffing, because they felt like that they weren't there for that reason, to learn how to be to protect in that fashion, because this is new for all of us.
Yeah.
So we've come a long way with our training stuff that we've done, and I'm very proud of what they've done to step up and include that.
Absolutely. Yeah, that's absolutely great, because we, not just the school shootings, but we see some officer-involved shootings on the media. So, you know, it is really important to get in there and educate students, you know, not to be afraid of police. They're there to help.
Right.
So that's really great. We talked before we started airing about how long you guys have been police officers. What's changed from when you first started to now as far as the substance use issue?
Well, when I first started back in fall of 1986, what we had was people drinking and driving and growing marijuana. You didn't see very much of any hardcore drugs, heroin, or cocaine, or crack. But as the mid-90s started coming on, then you started seeing cocaine come in, and then pills started making a surgent in through there. And then it just went to the pills, then went to the crack cocaine, and it just seems like it just kept getting worse when it comes to the hard drugs, to the point now that, like the sheriff said, when he took office in 2013, we were having an onslaught of meth labs, and we were dealing with a tremendous amount of neutralizing meth labs. And then it actually started going over to the heroin, and heroin's been our biggest issue that we've had. The sheriff, along with the Gallia County Sheriff and the Gallipolis City Police Department and the Middleport Police Department, with the Attorney General's Office through the Ohio Organized Crime Commission, formed a task force where our task force is combating the issues of the drug trafficking. And then once they're able to, make a case against somebody and they actually get indicted, and if they are sitting in jail as a pretrial felon, then there's our opportunity to get some assistance to them, if it's mental health services or if it's addiction services. You came in and started working with us with the mental health, because as we've talked before, if you have a drug addiction, you're going to have a mental health for dual diagnosis.
Yeah.
And that's what we've tried to do, is try to give those services to the people that are in need of it, to get them the help, so once they leave our facility, then there's services with them when they go out to help them continue with that road to recovery and mental health services. So the chances of them coming back to us, we want to reduce that and get them the help they need, so that way they can actually live their life and be as happy as they can with the help, with the services provided. And that's what we've been fighting for, was just getting services to people that need it, and to give them their lives back.
I think, and I'll add to what Scott says there, that I think that a lot of times you look at a small community and you think, well, we don't have the resources or we don't have the funding, and it's usually kind of true, but we still figure out a way that fits our community. We've tried to figure out how we do it together, and with the recovery services that's been helping us since I've been in office has been absolutely tremendous, but a lot of times we get, when it gets beyond us in our county and trying to find other resources to help us, that's where we struggle sometimes, and we all know we do, but we still try to come up with a solution to help this. I mean, you still have, I've always said that a lot of times that the loser is or the user is the loser. Well, we want to get away from that. We want to be able to help that person and reach out to that person and give them opportunity to get that help. And like my major said, with the mental health issues, it's a struggling thing for every law enforcement agency. I talk to different sheriffs across the state, and they deal with this all the time. And we run into a lot of problems as far as where we're at in a small county. We have a old jail that we can hold 5 people in it, and it makes it difficult for us in that old building to expand where we need to be. Sure. I mean, we need to be able to go. I always say I try to keep ahead of things, but it's difficult when you're in a building that's built in 1896 and
Right.
you're trying to function out of that and do things that needs to be done because the problem still exists. It's not always about a criminal situation that's going on of an inmate or whatever, but we deal with a lot of different things there. We have children that come in that do have problems. I have people that walk in my office asking for help for their children. And a lot of times you don't have a lot of resources that you can do with that. It's you're kind of left with a blank that you have to figure out, okay, how can I fix that?
Right.
So I think we've gotten better through with you guys, and our agency has tried to create the fix, or at least attempt to fix this problem.
Sure.
So
I'm hearing from a law enforcement perspective. It's not that, arrest them and throw them in prison mentality anymore. It's, let's
can't
do
be.
something together to address this problem. And it sounds like you guys are working with mental health and addiction providers in that system. What do you think the answer is here? What's needed? How can, different systems like mental health and addiction and law enforcement come together and you also mentioned your jail was built in the late 1800s, and we're dealing with 2018 problems now.
Right.
What do we need?
I think that it's not about a building. It's not about brick and mortar. It's not about, it's about what the contents are within that's going to fix this problem. I think that me, personally, I believe with my near 40 years experience in law enforcement is you have to focus on education in the schools with the kids. That's a priority that we have to do. I mean, that's not something that we think that sounds good or this is maybe a solution, but it truly is. If we don't reach young minds and focus on this generation that's coming up through this, where are we going to be 20 years from now with this? What's going to be the impact that if we don't make major attempts to educate and teach the students what this problem is? I think we've gone leaps and bounds from where we were a few years ago, but the hard part is we keep facing hurdles of, and again, it goes back to a lot of times funding to be able to take care of those things. A lot of times there may be some monies available if you have a place you can do it. That's why I'm trying to create a place that we can do those things in a correctional facility, a justice type center. But it's not about arresting your way out of this. It's about creating a solution to this from when they get out of prison. Maybe they're coming back, maybe they're not going to prison, they're on community control, but there's things that we have to look at as a community of how do we fix this problem together. It can't be an individual idea. It's got to be everybody comes together. Today we had a meeting at the schools, and we're forming a safety council commission in our county that is going to have a lot of people involved in it. And it's going to have from the judge to students to teachers but we're including people in things to bring them to the table, to meetings, and talk about it.
Sure.
And any problems within a community can be solved if you sit down and try to iron these things out.
Right.
But if you
Because everyone comes with different perspectives.
Sure they do.
Right, and different
Sure.
potential solutions.
Everyone has different problems, and so we have to tackle these things together and try to work things into a solution.
And even though you said Meigs is a small county, about 24,000 people population. You know, you're also working with Gallia County Sheriff's Office with, you know, the task force and things. So it really sounds like it's not just a Meigs problem, it's an Ohio problem or a United States problem.
Exactly.
And we're all kind of in this boat together, so it's really great that it's a collaboration.
Well, like the Major said with the task force, I mean, that's something that you got 4 agencies that came together, and we have accomplished a lot of stats. We've accomplished a lot of, and arresting your way out of it, no, but you've got to keep this thing pushed back. You got to get out in front of it. You got to try to stop it. We've taken a lot of big dealers down in this community. And we are going to continue to do that. Our task force is strong, and I will say that to any place that I've been, that if you're out there and you're doing it, you want to be the next one on the list, we're going to put you there. Right. So is that a warning? Absolutely. But we got to take care of our community.
Sure.
I'm sorry.
No, go ahead.
The one thing that I see that we're having our major difficulties in is when we was talking about the correctional facility and the Justice Center, is we don't have the facilities in the jail we have now to address those. Getting a program like mental health or addiction services, there's no place for the services to come in to treat or to counsel the people that's actually in custody. And that's our biggest struggle, in my opinion, is getting them the help that they need, because we don't have the facility to do that.
And they're going to go back to the street. That's the thing that people have to realize, that they're not, you know, they're going to be going back to the street. We need to try to get help for them, because just because they're an inmate or they're a prisoner, and the mindset a lot of times of the public is, well, we don't want to worry about them. Well, you have to worry about them, because they're your kids, they're your grandkids, they're moms and dads in jail. You have to find a recovery point that you can get them back out to society.
Right.
You don't want them going just back to the street from prison and they're right back into it. I mean, it's a continual cycle there that's not going to stop.
Yeah, it's definitely, it goes back. It's not just an addiction issue, but it's, you know, in your case, it's a public safety issue.
And we see a lot of return people. I mean, we have a lot of return folks. I know we had some statistics on how many people last year was on probation, and
in 2016, they had about 150 people that was on probation through the Common Pleas Court, and of those 150, we had, I think it was 86 people that actually came back through the system.
And pretty quick.
And pretty quick. And that's not to mention the people that are in there that are have addictions that would serve a period of maybe 30 days or 60 days, get bonded out, and then within a couple days, you know, we get a call that they've overdosed and passed away. There's no help to the people, and that's the one thing that we've been striving to do, is give them an option, give them the tools to go out and take care of themselves and make themselves healthy. And in the facility we have now, we're very limited, we're very constrained, and we try to be creative when it comes to mental health services and the addiction services. We brought in the CIT back several years ago, and we've sent just about everybody we've got a few new employees that has to go through it, but at one point 2 years ago, everybody in our office was CIT certified, and that's the beginning steps for the mental health, to be able to see the people that are in distress, and to get them taken care of, to get them the help they need. And that's one thing that we really train on, is the CIT, which is crisis intervention training, but we don't have that for the recovery services.
And I think too, it brought us closer to the recovery folks, to where there was a bridge or a gap there that wasn't, but I think we drew that closer to each other. I think that it made us aware of where we need to be going.
Sure. Yeah, it opened up a line of communication there.
It did. It certainly did.
So CIT is crisis intervention training, and the little bit I know about it, it's training law enforcement in mental health, like de-escalation,
Right.
and what psychosis looks like and those type of things.
Right.
Could you guys walk us through maybe a day in the life of what you do for a living? What some of the mental health or addiction crisis, what's that look like, and kind of help the community get a picture of why these programs are so needed.
Well, I'll speak for myself and I'll let the major tell his factor of it, but my day starts out, I love my job, I love what I do, I care for my community. Meigs County's been my home all my life. But I love Southern Ohio, I love the people that live in this community. But when I walk out every day, I know I have some type of plan that I'm going to be doing, involved in, whether it's, but my mission at the end of the day is I want to be able to go home to my family, and that's my priority. Sure. But I'm going to get a lot of things done in between that time frame. I want to elaborate a little bit about what the major said with the mental health thing at the jail. We've been working very hard of trying to get a new facility, and again, I don't want to harp on that too much, but it's important for our community. It's got a lot of nuts and bolts in there that we've got to have to fix this. So I've focused a lot of energy towards that project, like for 3 or 4 years. But I feel passionate enough about it that I feel that we need to be there. We need to do better. And so I focus on energy, of high energy to what I do. I want my people to do the same.
Sure.
And I want us to be involved with the community, knowing what's going on out there.
Absolutely. Major, tell us some of the stories that you come in contact with when you're dealing with mental health or addiction crisis. What's that look like? You know, because I think the community doesn't always get that picture.
Mental health wise, anybody that we run into in the line of work could have any kind of mental health issue or a drug addiction issue. Just whenever they respond out, any of the deputies respond out, they don't know what they're going to get into, and a lot of times there's one or two, either of those items is in that. Just to be specific, when it comes to people coming in, anytime that we bring somebody in, no matter what the charge is, you usually hear that they need to talk to a counselor right off the bat. And of course, we give you a call down at your place and have someone come get evaluated. And the play is if they can get out to a hospital, mental health hospital, or if they can get out anyway, this is the tactic they use. And that's what we have to use our CIT skills to see if they're really in need of counseling, crisis intervention, to be able to specify, okay, this person really needs to be hospitalized, or if this person is just saying this just to get it out of jail, because of course if they're have an addiction, you know, they're going to be sitting in jail till they go to front of the judge for a bond, if they even get bond. So then they're going to start getting sick through withdrawals, and they don't want to go through that. Right. So it's an ongoing thing every day that we deal with, that the public, I don't believe, actually understand what is going on. And if they were just to actually sit in there and watch what happens, I believe that they would all be surprised of exactly what happens in that little building that's 120 years old, exactly what's going on in. And some people would be just, in my opinion, outraged that this is the situation we have to work in. Right. And I think that would be an eye-opening experience.
Can you briefly paint a picture, like what's been a kind of a scary call for either you guys personally or officers that you supervise dealing with mental health or addiction? I know you respond to overdoses, people losing their lives.
Domestics, you don't know what's going to happen, and it could be the mental health issue.
What does it look like when someone's psychotic and you guys respond to that call?
They're really talking out of their head. They could be acting very unusual, violent. It's just, they could go from not wanting to talk or talking to items to just being totally out of control and not really making sense. And once you start seeing that if they're not being reasonable, then you start thinking, okay, de-escalation. Let's see if I can't talk this person down. And depending on their point of being manic right there, actually knowing the signs to say, okay, now I've got an issue. So, and if they're that bad, we can take them to the hospital to get them medically cleared, and then if they're in custody, then we bring them, give you guys a call.
Yeah.
We never know how that day's gonna,
It could be anything.
yeah,
right?
because it starts out mild and we end up into something crazy. But, you know, one thing I'll say in my thoughts about what we do, our job is to save people's lives and protect people. And that's what if I can look at the end of my career and say that I reached a point that I helped save people's lives from drug addiction problems, or that, I've always been the person that wants to help people. So,
Absolutely.
and I think when we choose this profession, that's usually where most
Yeah.
of our folks are. I hope they are, because
Sure.
that's, you know, that's our goal.
Yeah.
is-
I hope that we have been able to give the community a clear
I do
picture of
too.
what you guys do, and I
There's
want
a lot
to
of
thank you
things,
for
yeah.
your service in protecting our community. Thank you.
Thank you.